very involved people from OSCAR, from our OSCAR universe, I'll call it. So on Zoom is Peter Hutten-Czapski from rural Ontario. He waves, so there he is. And here in Robson Square, we have on my left, I guess, Dr. David Chan, Joseph de Molen, and Earl Wertheimer. So what we thought we would do is basically have them discuss, elements of what this whole OSCARCon theme was, the future of OSCAR, and we had certain ideas we throw out, and we want to just pick their brains and learn from their infinite wisdom. And I'm doing this off the cuff because I didn't print out my cheat notes. Bear with me.
I didn't print out his cheat notes.
Well, I mean, we heard it earlier that over the last 3 years, there's been incredible development within OSCAR. Within our own lives, our style of practice has changed. We've pivoted so many times, my head's still spinning. It's gotten very complex. But we still need to work with a specific tool, and in our midst is OSCAR, and how that grows will affect how we work. So we've heard a little bit of what the future might look like, and I'm hoping that we can maybe review what our panel might feel is critical for OSCAR to move on and for us to do the job that we want to do. Several questions were posed. From OSCAR's BC's perspective, we want to have the ability to have efficient, accessible, and interoperable EMR. I think you heard elements of that. Accessible could be from a financial standpoint, from a patient and a physician standpoint, and from the other healthcare agents' standpoint. Being interconnected is critical, and how that is being done may be successful or maybe an abject failure, depending on who gets to speak up and basically advocate for the patients and for us. So what can we do as partners, as OSPs, as users, to make sure these changes are for all our benefits, and that's important. So hopefully we can touch on those elements, and I'll just hand it over to the panel.
Maybe start with one.
Yes, who would like to jump in first? Earl.
I can just add a couple of words. I mean, I live in Quebec. Sorry, I live in Quebec, so I'm kind of out of the local world, so to speak. I'm on the opposite end of Canada, just about, and I can see the change. I've been coming to these conferences for many, many years, to BC and Ontario at Stone Church, Hamilton, when they were there, run by David and McMaster. And my point here is that you, the users, contributing to a group like OSCAR BC is vital to the future of the software. There is no other way that the software will survive. McMaster put a euphemistically, a burning crater into the user community in Ontario. It's gone. There were hundreds of people who would come to our meetings at the Stone Church in McMaster, and there is zero activity. I mean, Dr. Ian Punn puts on little mini conferences, but the switch has been incredible. I remember hearing complaints from people in BC that OSCAR was Ontario-centric, and they were pissed because whenever there were programming changes made to OSCAR, invariably the billing would break in BC. And it kind of was, unfortunately, a consequence of there was a very good user community, but not into the programming. So the programming was done with Ontario first, and BC was an afterthought. And now we're, 10 years later, and there is nothing in Ontario, and you guys are here. So I can't stress enough the fact that you're coming to these meetings, you're participating, you're asking questions, you're sharing your issues. I've been doing IT for a long time, more than 40 years, and I can pretty much say that the last thing or a lot of these other proprietary companies want is all of their users to be in one room together to complain, right? And we look at it as an opportunity to improve OSCAR. You know, OSCAR is not the best EMR. It certainly has room for improvement, but you are the, if you want, the engine that's driving the bus forward, right? And it's really important that you guys share this with other people, come participate, and you know, if you have complaints, we're here to hear them. So that's my point as far as the future of OSCAR.
Thank you, Earl.
I actually,
I need to interject here if I can. That's okay.
Go ahead.
OSCAR is not dead in Ontario. In fact, we've had a huge amount of development over the last couple of years, and OSCAR 19 is alive and kicking, and has moved from the user interface perspective anyway, miles ahead of where it was. And so there actually has been a significant amount of development, a large number of man hours put in, and the OSCAR is being completely reskinned. Rather than changing the UI as we tried before with OSCAR 15, with the new UI that was roundly ignored by our members, with the exception of Juno, who I think tried to resuscitate it. I'm not quite sure if they were successful before they well bought them, but I hear rumor not quite. But rather than doing that, is that we have on a iterative basis have gone through the existing UI and have updated it to a more consistent, uniform, modern, bootstrap interface, and have added a number of user sort of suggested and usability features that make it slicker than before. We have ported some stuff from the good efforts of corporate OSCAR, OSCAR Pro, if you will. They don't make it easy, but there are a number of changes that OSCAR Pro that have inspired us, if not completely cut and pasted, to OSCAR 19. And also, I would point out from BC, from Open OSB, we have certainly also taken some bits and pieces from there. I would point out the Messenger is now pretty much based on BC, although we do have rich text, we do have WYSIWYG, so in other words, you can bold and you can do those type of things that you can't do yet, I think, in Open OSB, and of course there are a number of other modules that I can't remember all off on hand, but we certainly have cross-fertilized, and there has been significant growth in OSCAR. I think it really relates to the fact that we've dropped the various issues that have occurred from OSCAR being run entirely by McMaster and being driven by Ontario MD, and driven by various, this funding opportunity and that funding opportunity. By unshackling those things, we have made all sorts of possibilities happen and occur in Ontario. And what's going to happen in the future, we don't know, but it certainly has. I think I would take exception to the fact that we're dead in Ontario. We certainly have made significant changes, and there is an ongoing interest. I'm not particularly involved with it, but with Ian Tunn is certainly in terms of the users. That would be both for well and OSCAR 19, I would imagine. That's enough of my interjection. I'll just wanted to put in a word.
No, absolutely. What I guess didn't get across is it's the user community that I miss in Ontario, not the programming. Just to make sure everybody understands, Dr. Hutten-Czapski is the driver of the code of the dev version. Without him, it would not exist. So I want to make that very, very clear. He's doing an incredible amount of work to move OSCAR forward. and that should go with, you know, that has to be recognized, that without him driving the bus, it would go nowhere. My issue really specifically was the user community, not the development of the code.
Yes, thank you. And thanks, Peter, for your comments. We'll try and keep this as relevant as possible to BC, since that's where we are. But yes, I think this, I don't want to call it a rivalry, but this difficulty with Ontario has been there from day one, and really start with the billing. So I'm going to have our panelists kind of keep their comments or talk to about 5 to 7 minutes, so we can stay on time, please. Thank you.
So I haven't prepared anything. Just thinking about what I felt over the last few years are critical issues. I'm actually an ecologist by training. I've got a master's degree from the University of Waterloo in that space. So I've always looked at digital health for the last 30 plus years as an ecosystem and so forth. And then when you look at that, there's the code, there's the community, there's the energy that goes into the system to make things work and sustainable. And that energy can take the form of code, people's time, or really importantly, money, because money can buy code and money can buy time. And I think one of the biggest challenges that we've had in open source in general and in digital health especially is we didn't spend a lot of time thinking about designing the economic part of the ecosystem carefully. I think that's one of the reasons that, and if you look at the dynamics, I mean, what's really amazing about BC is the fact that you didn't get addicted to government subsidies for this product. That was a really, really, really important differentiator, I think, and that's why you're still here. Whereas in Ontario, it went the other way, and you saw what's happened. I was one of the founding directors of OSCAR EMR. With over 2 or 3 beers, I can tell you what happened there if you want. But basically, the dynamics, thinking that part of it through, we never really thought about it. We were very altruistically focused on having something that was, having software that was evidence-based and driven by, you know, the evidence-based model in healthcare and so on when we started all this. We also wanted to insulate software from corporate buyouts. How many of you know Health Vision? Have you ever heard of Health Vision? Okay, so Health Vision was one of the top hospital EMRs. I used to manage Digital Equipment's Canadian healthcare business. They were one of our software partners. They were, EMR was developed through UVic, it was developed here in BC. It was eventually bought by a US venture capitalist firm, moved into the United States and disappeared. I mean, I've seen this time and time again where you have, you know, corporations buying other corporations and so on. And so one of the notions behind open source design was to insulate the code from those kinds of transitions that occur because they're often not for the good of the end user, and in our circumstances also not in the good of patients and people. So I think one of the things we're still working on, I happen to be sort of leading OpenOSP and the design thinking behind the co-op and the co-op business model was that it was more closely aligned with the value system of open source and so forth. And I've gone through all the other models too. I chair a US nonprofit, which is a charity also. As I mentioned, I was involved with OSCAR EMR and so forth. So I think one of the critical things, and we haven't got it right yet, is figuring out that economic model, because in the end, software needs to be supported, clinics need to be supported. You can't do that for free. Okay, so we have to figure out how to make that work in a way that still supports the value system of why OSCAR exists in the first place.
If I may say, just another thing about Peter is that he's the most humble guy. He would always address himself as a non-programmer, and yet I know of nobody who, whatever knowledge he has in programming, he had done a tremendous job. And I hope, Peter, you're hearing it. Oh, we need more Peters. Now, I think I just want to touch on something that I may not come across as totally in agreement with Joseph. We used to be working for the same company. You know, my first one of my first jobs is with digital equipment. I don't know if you know, you probably don't know. We were the second largest after IBM in terms of companies. And I was one of those people who designed, this is before internet, so we had the DECnet, digital communication, 9-layer protocol. And I mean, it's amazing technology, but it's proprietary. Guess what wins out at the end? TCP/IP, the very foundational basis for our internet today. Why? Because it's open. It was designed, it was given away to the world as a gift. And look, is there any moment in your, right now you've got your phone working in the background. It's always working. I think the open sourceness of our work, we have to commit ourselves to believing that by giving, we're going to get the most. We are going to receive the most. And I firmly believe in it. And I know we should need some money to do some development. But generosity goes a long way. There'll be people who don't play the same game. In my worst moment, I call them thieves. But most people at some point would realize that it needs everybody's ideas and putting into action. You start with small things, like the e-form is an example. In my wildest dream, I never, would believe that there would be so many trained as a doctor, and yet they would be fiddling around with HTML and CSS and all these little coding to make this e-form as dynamic as it is. So I think this community is important, and also, hopefully this morning, you've heard enough from me about innovation is very important. Because if you look around, nobody stick around forever. Most of them die. I used to call it the fifth installation syndrome. It's not based on any scientific study, trust me. It's just that when corporations start building more and more users, they are less and less able to put innovation in. It's getting harder and harder. Like Well right now has to deal with I don't know how many vendors and how many systems. At some point, it's going to kill them. It's just hard, okay? Or they force all their customers into using something that they never wanted to use to start with, but then they're stuck, right? It's another form of vendor lock-in. If you had begun with a proprietary system, you know what that meant, right? And so innovation, in the whole area of decision support, like Know to Act, personal health record, completely transforming the whole healthcare scene to envision a future that is way more, individual. Don't apply group statistics on me, necessarily. You can learn what you need to learn, and there are lots of good things we learn from groups, and we compare groups. We do double-blind, randomized trials, and all those things, right? But at the end of the day, individual matters. And it's more than my value system. It's about all the little digital footprint and all the little things that actually has impact in my life. And more so in the future as we, wear devices and, we're being tracked with video cameras everywhere. But I mean, if you think about it, there'll be just lots and lots of things. The future is amazing. And I don't believe any of the existing EMR would even think that far. They don't. The bottom line is their market share and how much money they bring in. They were too preoccupied to really be very innovative.
I can't agree more. We have about 30 minutes more, and several questions were posed to our planning committee for this panel, but I think I'm going to try and kind of combine them into sort of a unified theory of relativity, so to speak. And it kind of goes like this. We all need an EMR tool. How do we ensure that, all the different variants of OSCAR, and there are, have, the latest, greatest features, standardization, so that we all work with the best tool available, and to prevent, forking, I suppose, and additional things that are forcing us to, use, more expensive subscription and APIs and such. How do we make sure that, the features that we need are going to be there going forward, because we all mostly have vendors. Some wish to self-host and whatnot. I know Peter does and does a great job of it, but most of us have a day job and it's not programming or developing. So how do you see us having, as an end user, having influence on that?
That's a tough. I mean, Peter is at one edge of this whole issue. I mean, he is actively, as he mentioned before, he's picking stuff out of OpenOSP. He's picking stuff out of OSCAR, Well Health, OSCAR Pro, and he's building it into the dev. I think that's one effort. I mean, that's the only thing that we can do, because legally, it's the downside of open source, is that there's no legal requirement for anybody, if they change the code, to contribute it to a particular trunk. I believe the legal requirement is simply that it be published. So that in itself is a step in the right direction. I know in Quebec we had a problem. There was OSCAR Quebec, OSCAR QC, sorry, and the company who ported the code refused to publish it, and ultimately it disappeared. But the work that Peter's doing is valuable, and I honestly, I don't see a solution to forking. I mean, it's part of the way it is, and in the long term, I think what's going to happen is the good code is going to win, one way or the other. Well may sell the whole business to TELUS for $1 billion, and you guys will pick. Do you want to stay with Well? Are they going to migrate it to something else? Do you want to go to OpenOSP? Do you want to do something else? I mean, you still have choices. But I think it's part of it's an unfortunate byproduct of the choice for open. There are many advantages, but it's one of the significant downsides.
Yeah, governance isn't easy, and it isn't inexpensive. I mean, especially in something as complex and life-critical as an EMR. Some of the things that Ontario did, I'm sorry to bring up Ontario, but the whole certification part of it, and I was involved with another EMR in the United States with Vista in the US certification process, and my first reaction was, this is a government attempt to kill open source. In part, I'd say it is or was, but also in part it also created the discipline to make sure that code was safe. So going through like a threat risk assessment and a privacy impact assessment, et cetera, is really, really important. And one of the criticisms of open source was that it wasn't as safe as proprietary code. So, which is a long way of saying is it's hard to get everything to get harmonized and so forth. I think you need to maintain the kind of innovation I'll call it in the wild, sort of, around the edges of all that structure that you need for actually implementing safe systems in clinics. And not everyone obviously has a skill set to do that. And it does cost money to do all those other things to meet different government criteria. And it's only going to get harder, I think, over time, because EMRs are so life critical in the scheme of things.
Again, I heard many people who complain that open source is inherently less secure, and I looked, okay, and then there are very few studies. I mean, I think one from Caltech. You're way more protected using open source because you have tons of people who are basically reviewing your code, okay? The proprietary software, under the hood, you never know. The famous Easter egg story. Like you can be paying for tons of, pay for a very expensive piece of software, and it was doing things that it's not supposed to do, right? And so, I'm a little more optimistic about the open source code, and being a little bit anti-government. I think all of these steps, they are meant for centralized cloud-based system, and all of these. ISO thing, ISO 9000, ISO this, ISO that. Well, tell me what benefit have you brought to the health of any community? Well, show me the evidence. I mean, the only one piece of really robust evidence comes from an open source software in Vista. If you look at literature, okay, the simple implementation of scanner of the risk, they proved that they reduced medication errors. As simple as that, right? I mean, guess who does it? Not proprietary companies, right? And so, yeah, I mean, I like to encourage all of you that you might think, okay, the reason I picked this one OSP brand of software, because we can't do without this one feature. Try to keep things in perspective. Stay with, in my case, and thanks to Peter, all of these voluntary agencies that I started come from the Debian code. Because you go there, you download, and 10 minutes later, the clinic is up and running. None of these contract with OSPs and on and on and on. Okay, now, okay, you say you've got a degree in computer science and all that. Okay, I'm just saying there are lots of people who can be taught very easily and install system for you. Okay, live without that feature, but pass it on to the listserv. You'd be surprised if Stan knows about it and he'll figure out a workaround using Grease Monkey, and before you know it, in the next Peter's implementation, it'll be in the code, okay? So it takes a little bit of time, but if you commit yourself to an OSP that is not necessarily faithful, I think you're just getting yourself into more trouble in the future.
Any further comments, Peter?
I mean, I think, what's there to say? It's always a little bit, it's always gray. There's never really quite something quite black and white with regards to this. And I mean, I think when you look under the hood in OSCAR, you realize there's all sorts of issues that have accumulated over the years, and we can chip at this and we can chip at that. But even though the whole thing works, it's not exactly state of the art. Let me put it that way. And the amount of effort to do that well is not putting in, and nor is anybody else for that matter. With the possible I will not give possible exceptions. I think no one's really has the bandwidth and the power and the interest in actually to do this. So it's not, from my perspective, it's never really been the software. It's always been the community that's been important here. And again, I mean, I will nod to BC here. BC has always had the strongest community as far as I was concerned. Even when Ontario was going more, stronger, it was very much directed through the Ontario MD model. People picked it because it was cheap, it worked. McMaster, few other issues, a few other points of thing, and so there certainly was a open source a user contribution base in Ontario, and Ian Pun certainly and others have been part of that for many years, and they remain to be so, including myself. But the big part of the community has always been in BC, who's been blessed and by not being able to be part of a funding program that would force it into being something that it isn't. And that continues to this day, and that's where we get, Stan's grease monkeys. We get all the e-forms. Certainly, if you look at the OSCAR Galaxy, you'll see that there's, for every Ontario e-form, there's 10 BC ones. And so this is really where the strength of the community is in BC. This is where Open OSP is, for crying out loud. Why is it there? Because it can be there. They don't have the bandwidth, in my estimation. Well, they didn't at the moment. I mean, it's the only reason why OSCAR 19 exists is because Open OSP wasn't in a position to service Ontario. There wasn't any code that worked in that, the fork that Dennis was using was not serviceable in Ontario. And so we had to keep, supporting the product that we had out here in Ontario, which evolved into OSCAR 19. And so it's the community that matters for OSCAR, and if there wasn't the community, there wouldn't be an OSCAR. Anyway, that's probably the last of my reflections on that particular point.
I think heard that theme many times, the community. It's what drew me to OSCAR in the first place. I want to thank our panelists for their candid points and opinions and answers. I also want to open the panel to our attendees here. If you have any questions, question back there.
I might just have a question for the panel on how any action steps we could take to grow the community with all the different integrations and solutions that are coming out. How do we grow the community meaningfully?
So Peter, if you didn't hear that, it's how do we grow the community with all the integration and the changes that are happening?
I think the community grows organically, and I don't think there's something that we can support it. We can certainly have OSCAR Galaxy and other things that help the community communicate with each other and to have everybody help each other. But as far as growing it, I don't think we can force it. It happens because it happens. Because people find value in it. And I think as long as we're aware of that and we don't turn our backs to it, it will grow by itself.
Take the comment.
Joseph.
I think,
Sorry, hold on, sorry. Mike.
yeah, no worries. Yeah, I think. Is this working?
It's on.
Paul?
No, it's not.
Peter,
Is it on?
Right.
Is it on now? Okay,
Yeah.
great, sorry. I think we can grow the community more virtually. I think you were experimenting with Chat GPT. I think one of the promising areas is what David was showing is more like around assisted coding, not necessarily replacing coders, so that we can actually amplify the value of the time people put into doing doing the nitty-gritty of the software development and so on. And refactoring OSCAR, like, yeah, it's built up a lot of, it's just like my closet at home. It's really messy. So it does need work. If we can find ways to amplify the existing community. But I 100% agree with Peter's comment. It's all organic in terms of growth.
Yeah, I would definitely echo that. I think so much happened here in BC out of necessity that we, didn't have a billing module that worked and that, got traction and got interest, and we didn't have, usable forms, and we had to adapt to that, and well, the rest is history. It's interesting your comment about Dennis's version being BC-centric, not fitting Ontario needs. Karma.
Yeah.
Any other questions? Yes, Dr. Budai.
So it's more of a comment than maybe you can get your opinion, because what I think is one of the biggest risks of OSCAR in BC is if our provincial government would come up with their own EMR, which I am a little bit smelling from Care Connect, for example. If you use Care Connect, I don't know if you're familiar with Care Connect, but it has, demographic, it has all your labs and all your documents. So in my opinion, to tweak that and that becoming an EMR with a single record per individual is not a stretch. So I'm just wondering if, as a community, this has been considered, because to me that would be definitely the end
Because Peter
of
can't
OSCAR.
So just for Peter's benefit, that question was the threat from government here in BC to choose a single EMR and perhaps using something called Care Connect as the platform for that.
I'm just going to dovetail off of that comment. So I was at a forum last week, the Health Quality Forum, and there was a workshop on hosted by the Ministry of Health and Doctors of BC, and they were speaking about something called MSPQI. And it's kind of reminding me of what your comment is. So I think they had two faces. They had the physician dashboard, and then the other side, the personal health record. And I think primary care did not seem to be on the top of the list, but it's there. So I'm wondering, like, what is the engagement going to be, right? Like, are they going to engage with community, with OSCAR BC to make sure that, you know, we're part of that conversation? Sorry.
Peter, did you hear that? Sorry. Apparently there's already discussions amongst major stakeholders, ministry, Doctors of BC, about creating some kind of a EMR, or at least interoperable access to data that so far it doesn't seem to involve, you know, the majority of care providers in BC, which are GPs, family physicians. And comment from the back from John Robertson.
Well, I think that's a very real concern. Certainly we've seen other countries and other locations that have done exactly that. For the most part, we've also seen them fall on their face because they just collapse under their own, they just collapse under their own weight. And another thing that would certainly make people suspicious is the recent survey that went out from Doctors of BC asking people what they thought about EMRs. And I mean, personally, looking at the survey, the questions that and how they were designed seemed to be slanted towards the idea of a single EMR for everybody. And, you know, how can we get you on this, and can we pay you enough money that you would go on this, or something like that. I think that there's a few sort of obstacles in the way of the government, and another one is named Well. And I think unless the government shelled out big bucks to buy them out, I'm sure that they would have something to say about the government creating a monopoly and taking their business out from under them. So whether or not we're fans of either of those groups of people, I think that them being there makes it much more difficult for the government to just unilaterally say everybody's going to be on this sort of a platform. I think we do have voices as individuals as well, and I hope that when people were filling out the survey from the Doctors of BC, they had some of that in mind. Certainly, I think that, as I said, we've seen this story before. It has not. We know the end of the story, and it doesn't end well. I suspect that it wouldn't end well once again.
Yeah. Comments?
Yeah,
from-
I mean, all it takes is another ransomware. Like, have you heard that before? And also, as long as this country runs on a healthcare finance model, you know, sort of like publicly funded but privately run, we're not exactly the UK, you know, or the American. And we have a very unique thing, and we are considered independent business. And our choice is important. That's why Ontario has gone with, you know, just like most other provinces, all of the provinces, as far as I know, at this point, is to give the user, you, the choice. You know, the whole thing about certification is just a way of appearing as if they're in control. But mostly all the software, I've been through those so-called certification process physically. I was in a room. It's just a joke. Okay, you just stamp, and then it's done. You meet everything that appeared to be important, and that's it, right? So I don't know if BC is going like this. I suspect there will be a few of you holding plaques out there and say, you're going to kill my business. You're going to kill the way I look after my patients, right? And anytime when you see a cloud-based, you know, centralized system, you ought to be suspicious for your patient's sake.
Yeah, my fear is not just killing our business, but killing our patients. I think we've touched a nerve here. We got the crowd going. Sorry, Joseph, do you
I
have
was
a
going to
comment?
say, just an interesting aside, the Competition Bureau has been investigating the consolidations of EMRs in BC, so it's kind of like, it's like two worlds, right? Anyways, whatever. That's a federal competition bureau, so.
Wow, that's incredible. We are actually 10 minutes from a coffee break. I'm very happy to start that early so we can network further, and then we can move on to the later sessions, if that's okay with everyone. So I want to thank Peter for zooming in from rural Ontario. Thanks so much for all your work. Thank you.
Thank you. Very good meeting, and more power to you.